In just over a month, the Texas legislature will take on a monumental task, steering the state's continued response to COVID-19. The Texas Senate's Committee on Health and Human Services held its first pre-session hearings last week to get members up to speed. Lawmakers heard from doctors across the state who detailed their experiences over the last 9 months. And despite those stories from the front lines, there are still people who don't accept the severity of the pandemic, some even calling it a hoax. The state's top doctor said those skeptics are difficult to deal with as Texas depends on the public to wear masks and take other steps to prevent the spread of the virus.
I think one of the best things that we can do is simple declarative sentences and say, it's real. No one is making these numbers up. No one's inflating the number of hospitalizations or death. It's not in anyone's interest whatsoever to do that. And the people who are saying something to the contrary are not telling you the truth.
The state is also working to streamline messaging to ensure the general public feels safe and is willing to receive a COVID-19 vaccine once it's widely available. While children don't fall into the most vulnerable category for COVID-19 infection, they're experiencing mental health issues at the same rate, if not more, than adults. That's the message some psychiatrists brought to the state Senate committee hearing. Maggie Glenn reports on how they're asking lawmakers to help children in Texas.
Sadly, we have seen the number of children admitted secondary to a suicide attempt double over the past 5 years.
Dr. Kia Carter with Cook Children's Hospital says the most difficult part for kids over the last few months is isolation.
A lot of our kids become hopeless, give up, not want to continue with virtual schooling because it's so hard for them to engage or interact or get the support that they need.
Other emotional outlets have also been limited.
We promote healthy ways to cope with stressors or difficulties, and a lot of that is kids participating in their sports, their activities, whether it be, and that's all kind of been stripped away from them.
But one positive of the pandemic is increased access to telehealth services.
In our outpatient clinic, the numbers of no-shows decreased significantly when telehealth was offered.
Dr. Carter and other mental health experts asked lawmakers to extend those services.
Extend the waivers temporarily through the end of session. Give the legislature time to weigh this and extend them out, make them permanent.
And they're asking lawmakers to consider increasing mental health funding overall this session for preventative measures and treatment options.
We know that early identification, intervention, and treatment is essential to prevent further complications of mental illness.
Maggie Glenn for State of Texas.
Voters in North Texas will decide next weekend who will fill an open seat in the state Senate. 2 Republicans advanced to a runoff after September's special election in State Senate District 30. That's Shelley Luther facing 4-term State Representative Drew Springer. Luther made headlines in May when she refused to close her Dallas hair salon. A judge sent Luther to jail for defying Governor Greg Abbott's coronavirus emergency orders. She was released when the governor removed the threat of jail time from his executive order. Springer has served 4 terms in the Texas House. He received endorsements from several House and Senate Republicans, as well as from Governor Greg Abbott. Election Day is December 19th. COVID-19 has shut down a lot of December plans, but it's not stopping some lawmakers from holding in-person fundraisers.
It's business as usual, and that can, I think, rub some people the wrong way.
How a last-minute dash for cash by lawmakers has some people worried about health risks.